Hypersensitivity reaction. So what is the hypersensitivity reaction? So it is the normal immune system act on the normal tissue and cell and damage that. It is known as hypersensitivity. It is termed also as a hypersensitivity reaction in which inappropriate immune response like damaging, discomforting is arise. Now, types of hypersensitivity. So there are different type of reaction, and due to that reaction, hypersensitivity divided into the four class. Now, this difference into the reaction is generate the identical reaction. It means if someone is allergic or having sensitivity towards the penicillin, so when we are giving that human penicillin, and that penicillin act as an allergen into the body of that person, and due to that allergens enter into the body and the cell form the complex with that penicillin ions. So due to that, some discomfort, some reaction, some hypersensitivity will arise. So according to this, the hypersensitivity is divided into the four class, and this division is done by the Gel and Kumb. So first three type of this are antibody mediated hypersensitivity, while fourth one, it means last type, is mediated by the T cell and macrophage. So here first three type of hypersensitivity reaction include the antibody, while fourth is including the T cell and macrophages. This is the general division of hypersensitivity. In first type, descriptive name is immunoglobulin E mediated, or we can say anaphylactic hypersensitivity. Initial time, we can say lag time. Initial time, it means how much time will conduct to show the reaction, to show the hypersensitivity symptoms. So after this immunoglobulin mediated hypersensitivity arise, after 2 to 30 minutes it gives the symptoms like in last column systemic and localized anaphylaxia, hay fever, asthma, hives, food allergies and eczema. This kind of symptoms arise when type 1 hypersensitivity is occur in our body. Now mechanism of this is antigen induced cross linkage of immunoglobulin E bound to mast cell and basophil along with the release of vasoactive mediators. So here antigen cross link with immunoglobulin E. Due to this, mast cell of the WBC and basophil of WBC release the mediator, and this mediator leads or give the symptoms like hay fever and asthma and all. Next is type 2. So it name as antibody dependent cytotoxic hypersensitivity. It leads 5 to 8 hours for symptomatic reaction. Mechanism: antibody act against the cell surface. An antigen mediate cell destruction by the complete activation or ADCC. It is antibody dependent cellular cytotoxic. So in this type 2, antibody is acting, and due to that acting against the cell surface, so antigen start the signaling, and due to that the cell, normal cell, distracted by this complement activation. So cellular activation of cytotoxins here damage the normal cell and give the hypersensitivity reaction like blood transfusion reaction for erythroblastosis foetalis. It is a neonatal anemia. Next is type 3 hypersensitivity reaction, known as a immune complex mediated hypersensitivity. It is initiated after 2 to 8 hours. Now, antigen antibody complex is deposited in various tissue and start the activation of complement, and due to that inflammatory responses are generated. So here antigen and antibody make the complex at the various tissue, and due to that complex the activation of complement is done by the tissue, and due to that inflammatory response are generating in body. Manifestation are like the arthritis reaction, serum sickness, rheumatoid arthritis. Next, fourth hypersensitivity reaction